I am super excited to have you on my show, Dr. Richman, and the conversation that we're going to have about all things sex and fertility.
Yes, I'm so excited to be here. Thank you.
Let's start with what was the catalyst to get into family medicine? Start where you want to start.
Family medicine is so versatile. You can really do anything within family medicine. You could treat babies, adults, geriatrics. You could do more OB if you want to, or gynecology. It really depends on what you want. You could go into different specialties, different fields. It's just like the gamut of medicine. And I think that we have such a difficult time having primary care physicians nowadays. I'm hearing even just from my friends, it's so hard to get a PCP, a primary care physician appointment. It's so hard to get a PCP, find a good PCP. And that's what family medicine is. It's internal medicine and family medicine. Those are your PCPs. So I just think that, for me, I love the field of family medicine just because of how expansive it is and how amazing the physicians are within family medicine.
Amazing. So, what do you consider to be the hardest part about being a doctor?
I think the hardest part about being a doctor is, I think it goes both ways, for myself or for physicians is truly the burnout,
Mm.
and when patients talk about, I can't find a good doctor, I heard another provider talk about this where it's like, we have bad days also, just like anyone else. Like we also have bad days, except we have to act great 20 patients in a row all day long for 5 days a week. And unfortunately, I think what's the hardest thing about being a doctor right now is that medicine is a business
Mm-hmm.
and it's not about the patient doctor relationship anymore. It's
Mm.
that I need to
Good
see
point.
you in 7 minutes because I need to do my note and get on to the next patient. And the most important thing is my note, because if I don't do my note and I don't document correctly, you could sue me. So medicine is no longer like this wonderful, for me, I created it. I do house calls and I love it. It's for Medicare, Medicaid patients. I spend as much time as I want with my patients. I only see 10 patients a day. I don't feel overworked or stressed, but that's not the case for the majority of physicians. And I think that that is the hardest part about being a physician today from our end. And then from the end of like being a physician as like a provider, like to
Mhm.
show up for your patient, I think the hardest part is like doing what's best for them.
Yeah.
Every individual is different, every patient is different. And maybe, what feels like pneumonia or a UTI for one person feels a little bit different for another. And so I have to listen to every single person and be like, okay, what is best for this patient? Because
Mm.
it might not, even though it's similar to my last patient, it's probably not the same. So I think that that's the hardest part when it comes to like patient doctor relationship is like, how can I do my best with the patient, that the person that I have
Mhm.
in front of me?
You created two amazing platforms, Glamour Puss MD and Docfluencer MDO. I'd love for you to tell us about both. And what does MDO stand for?
Yeah, absolutely. So I love that you asked this question because the New York Times just came out with an article about DOs. So you have MDs, which everyone knows, that's what a physician is. But also you have DOs who are also physicians. So MD is a medical doctor and DO is doctor of osteopath or osteopathy. And so they are the same exact thing. Both are physicians. Only difference between MDs and DOs is that DOs actually have an extra class out on top of what MDs have. And there was a lot of stigma back in maybe the 80s or 70s and 90s
Yeah.
around DOs. But if you ask anyone in the medical field, any MD in the medical field, we trust DOs. There are equals.
Yeah.
I would not, I would send anyone to a DO as equally as I would send somebody to an MD. There is no difference whatsoever, except they actually have more training than MDs do. And and I'm not a DO, so I can't, specifically speak on their specific training with this osteopathy, but I did have my residency program was split between MDs and DOs. And DOs, basically, the additional class that they have is kind of looking at the body and being like, okay, you have a pain in your wrist. Let's not just, MDs might be like, all right, let's just look at your wrist. I mean, we would probably do a lot more, but DOs look at the whole body. They're like, all right, it's connected to the elbow and the shoulder, but that also can be connected to your neck and the other shoulder. And so they have this very in-depth wealth of knowledge about how muscles and tendons are connecting, and really the body as a whole. Like I said, MDs have a lot of this, but DOs have just a greater scope of this knowledge. So that is my blurb on DOs. And so that's why I put at the end of Docfluencers, it's Docfluencer MD and then DO, because we're all physicians. And the reason that I created Docfluencer is because I saw that there was a need to change our healthcare system. And I am not a politician, so I cannot currently, and so I cannot change it within the political system at this time. And so I said, well, I am an influencer through Glamour Puss MD, and I'm a physician. So why not bring together all of the doctor influencers on social media so that we can make statements that are medically accurate and really fight misinformation? Especially, I'm sure you know the fact that people believe a TikTok influencer more than they believe their own doctor. Truly. And so why not just take those doctors, create more influencers, and now we could talk about medically accurate information. So I've created, I think it's the only platform right now of physician influencers online where our mission is to create a change in the healthcare system through our power and through our voices of social media. And so that's what Docfluencer MDO does. Glamour Puss MD, completely different. I started that in medical school and I'm still rolling with it, just because my attendings all told me in medical school, do not create a platform on YouTube talking about sex. And they were all my male elder physicians that were in their 60s and 70s. I was like, absolutely not. I disagree. I'm going to talk about sex online. And yes, I do have a medical degree. And just because I have a medical degree, it does not mean that I can't talk about sexual health. Health is health, and sexual health is part of our health. And the sexual health for women is just light years behind men, light years. And so I know we're going to get into it, but it's like, we've had Viagra around for how many decades?
Right.
Now we're talking about an O shot. Just now this is coming out. Like, oh, maybe we should be talking about that women aren't having pleasure. Like, God forbid that men don't have an orgasm. And here we are in 2025, women who aren't having orgasms still in their 40s, 50s, DMing me on Instagram, on YouTube, on all social media. I've never had an orgasm before. I don't feel comfortable talking to my doctor about it. And it's like, this is how are we just living like this and not helping women out? I am so charged about this topic, Lisa. But that's why I created Glamour Puss MD as well.
I just love how you're just opening up the conversation more and more, which we should be doing. I want to talk about, how did your interest in mental health start?
I took a course when I was 21. I was really, I had the typical, anger toward parents, in my teenage years, that you're angry about who knows why. And I was really figuring out, I called it my quarter life crisis, trying to figure out what I wanted to do with my life. And like, everything just seemed so hard and difficult. And my mom had taken this course in the 80s, and my whole family had taken it. Aunts, uncles, grandparents. It was like a 3-day life course, just to kind of like look at why you are the way you are, and what from your background and from your parents and from first relationships, first loves, like how has that shaped you? And I took this course, and it was just like the anxiety and the fear and the resentment against my parents just like melted away. Oh. And it was so freeing. And I was like, whoa, like this is what just working on yourself looks like. Like, sign me up, count me in. I love this. And so you know, everything from that course to therapy to, back then I was listening to like a lot of Tony Robbins, and now I'm into like other speakers. But like I just feel like every time I learn something about myself, I grow a little bit
Yes.
more. That boundary of what's comfortable is being pushed a little bit more, a little bit more. And that's what made me interested in, I bridge that into mental health as well. And so I see those as like two in one basically. So that's what sparked all of that. And I'm still very interested in that growth mindset and, constantly learning about myself.
And now, what are the top sexual health issues young women in general should know?
That's a great question. I would say women in their 20s, I think like one of them is pap smears. Like whether you're sexually active or not, whether you're having sex with men, women, both, does not matter. At 21, you're getting a pap smear.
Yeah,
And I think a lot of women don't know that.
yeah.
They're like, oh, I don't have sex with men, or I've never had sex, or, it doesn't matter. When you turn 21, you're getting a pap smear. I think the other thing is around STIs, which, we've transitioned to calling them STIs, which are sexually transmitted infections, and no longer STDs, which are diseases. It really just, I mean, it's a nuance. It really
Hmm.
is mainly in the medical field.
Hmm.
But, with STIs, somebody might have a sexual encounter with a new partner, and then maybe they don't use protection and they say, oh my God, I have to go get tested. And they go to the doctor the next day. Nothing is going to come back positive. It is way too soon for any STI to come back positive. Most of them maybe will be 2 weeks. Syphilis will be a few months. And really, what I would say the rule is if you're having sex with more than one sexual partner and you're not using protection, I would say you would want to be getting tested at least every 3 months. Or if you have new symptoms, then you want to go get tested. So I think that those are like the two main big ones. And then another one that a lot of young girls come to me about is that they've never had an orgasm before, and they've been sexually active for years with their partner and they've never had an orgasm.
Wow. It's great to educate young adults about sex and normalizing these conversations, especially about their body. And when we go to our primaries, I feel like you just get the bare minimum right now. And it's just reaching a whole wider audience and making people feel less alone. So we are so intrigued yet so embarrassed about talking about sex. And in light of the recent viral video of the CEO and his head of HR at the Coldplay concert, what's your take on this?
On which part?
On why we're so embarrassed about talking about sex, but yet we're intrigued.
Yes, yes. I think that there's so many different levels of this. I think one of them does have to do that we come from this Puritan culture.
Yeah.
Uh, and I think that I guess I would say, from a biological standpoint, from a medical standpoint, I would say that, there's a reason that we have this, pause around sex. I think one of the reasons is that, there are infections and diseases out
Yeah.
there that we can contract. And so we have to be a bit, you know, at least like think about something before you encounter a new sexual encounter. I think that we're intrigued by it because it's, again, biologically, it's what keeps the world going,
Yeah.
right? It's procreation, it's in the genes that we have. But there's still that stigma that we've learned to have through parents, through education systems, which might not even talk about it, parents who might not even talk about it. Us not fully understanding it either,
Hmm.
right? We don't have the exact answers. When's the right time to have sex? Who's the right person to have sex with? There's a lot of unknown when it comes to sexual health and sexual wellness and sexual desire, that I think that that's one of the reasons we have such a big pause when it comes to sex is that we just don't know all the answers. We don't know how maybe to give those answers to people that we love, or give those answers to our children, or friends, and or to even ourselves. So I think that, sexual health is something that we are still figuring out. It's almost
Mhm.
like it's the brain, it's like the last frontier where we don't have all the answers, and medicine is constantly evolving. And I think even sexual health is constantly evolving. We didn't see people who were polyamorous or in polygamous
Yes,
relationships. And I think that that's
exactly.
becoming more and more common.
Yes.
So I just think that it's ever evolving. We're always learning, but I still think that there's a lot of unknowns still. And that's where a lot of the fear comes from.
Talk us through what happens during an orgasm from a physiological standpoint.
That's such a great question. So, from a physiological standpoint, and
Yeah.
I learned this pretty recently. I didn't realize how much the pelvic floor has to do with orgasms. And so what's going on is you have this rhythmic contraction of pelvic floor muscles that also involves genital organs, the vagina, the uterus, the cervix, the anus as well. Of course, the G spot's always in there, which, as you know, I always like to remind people that it's not an actual button, it's just kind of like an area. And so it's this rhythmic contraction in addition to a surge in your sympathetic nervous system.
Mhm.
So when we talk about the sympathetic nervous system, we are talking about the fight or flight response, right? All of the, you can also have flushing and your heart starts to race. And so you have, neuroendocrine components that are also involved. And something that I learned recently actually is that you have an endogenous opioid, and you have an endogenous opioid release,
Mhm.
which is that, that pleasure, and which is one of the reasons that orgasms feel so great.
That was fantastic. Thank you. I've never had anybody clearly give the best definition from that standpoint like you.
Great.
Do you think there is a very strong connection between our emotions, our internal state, and our sexual pleasure?
And
Yeah.
I started doing these new TikTok videos, and the TikTok videos are about being multi-orgasmic. So it's about being multi-orgasmic on these TikTok videos. And I started doing this research on my own, nothing legitimate, on TikTok, where I'm talking to this community of women who are talking about being multi-orgasmic and how
Mm.
that happens. And one thing that is I'm hearing over and over and over again is that they let go completely emotionally. Like, they are no longer in their head. They aren't thinking about the grocery list. They're not thinking about what they have to do in the morning. They're not thinking about the laundry. They're not thinking about what they have to do at work and how many unanswered emails they have. Like, they're not thinking about any of those things. They completely let go emotionally and mentally. And they say that that is one of the reasons that they not only orgasm, but orgasm multiple times.
Mm.
And so I think, again, untapped frontier is that mind body connection. And just how we have anxiety that can manifest as an upper GI, like an abdominal pain, right? I think that there's that mind body connection when it comes to sex that, again, we haven't fully discovered or researched, but it exists. I am very confident that it is thoroughly connected.
Love your take on that. So, piggybacking off of that, what is vaginismus?
Yeah. So, vaginismus, so this is going to be, again, pelvic floor muscles,
Mhm.
and it's going to be the involuntary contraction or spasms
Mm.
in the pelvic floor muscle, specifically in the vaginal canal. So the vaginal canal is a muscle itself, right? And when we talk about the vaginal canal, um, we are talking about the inside. Okay, a lot of people think of the vagina as the outside of the external female genitalia, but that's actually called the vulva.
Mhm.
So We're talking about the vaginal canal, so that's inside. It's again spasms or involuntary contractions. However, the thing with vaginismus is that it's multifactorial, which
Mhm.
is happens a lot in medicine, right? We have it's biological, it's psychological, and it's also societal, I would say. And it's not just one thing. And the thing with vaginismus is that the way to treat it, one of the ways to treat it is that you do have to go and maybe see a cognitive behavioral therapist, go to CBT, also a pelvic floor therapist, and they could be doing exercises called dilations, which helps dilate the vagina. And with vaginismus, it's painful. It's painful
Mm.
to just insert even a tampon. It just
Wow.
feels like a block, a finger, a penis, whatever it may be. It's very painful. And so I think, again, it's something that's not completely and fully understood, especially in medicine when we say, oh, it's multifactorial. It's just because we don't have it pinned down to a
Hmm.
T.
Hmm. It sounds really painful, but it sounds like there's hope. Uh,
Yes.
yeah.
Yeah.
So, switching gears, let's talk about your egg freezing journey. You recently shared your egg freezing journey online, and tell us what made you decide to do it and about the life-saving procedure that you had done.
Yes. Oh my gosh. So I decided to do it because I'm 36 years old and I have a partner, but we're probably not going to have kids for another few years. And I really see this a lot in medicine. We have a very long educational career. And by the time we're ready to have kids, you're already might be in your mid 30s. And so I was like, okay, I want to preserve my eggs and I finally have money to do so. And so, because, egg freezing is really a privilege, it's for people who are able to afford it. And what happened was I was getting my ultrasounds and they couldn't see my left ovary and they discovered that there was a cyst there, a cyst called a teratoma, which always in medical school, it was like, it's benign, but we would always joke about teratomas because they can have hair and teeth.
Oh,
They're a really interesting
oh,
type of tumor because it is still a tumor, but it can also be, benign in the
right.
abdomen. And so that my left ovary was being compressed by that tumor. And I never knew I had it. It was like the size of a
Wow.
grapefruit. And the majority
Wow.
of the time, you won't even know you have it. However, they still had to remove it
Uh-huh.
because the size of the teratoma that I had like a 1% chance of causing something called ovarian torsion, which is when the ovary and the fallopian tube twist. And that is a medical emergency because it could cut off blood supply to the ovary and to the fallopian tube.
Wow.
And so I had that surgery. So thankfully, I had my eggs frozen and that they found the teratoma and then that I had that removed.
Yeah, thank goodness. Now, you have a clean slate to
Yeah.
move on. Thank
Yeah.
goodness. So, since you've shared your egg freezing journey, what kind of fertility questions are you getting?
I was getting a lot of one of them was, should I just be getting an MRI just to see if I have a teratoma, even if I'm not going through
Good
egg
point.
freezing, which is so valid. I
Hmm.
would have never known that I had this benign tumor. Typically, you present with symptoms. And I would say, even if it's something that's not benign, you likely, as a woman in your 30s, like you might not have symptoms. So I wouldn't be too concerned about it. Of course, you probably could always get an MRI, but that's coming out of your pocket, that money. And then I think another question that really is coming about is what age should I be doing this at? And I actually spoke with the reproductive endocrinologists and the reproductive OBGYNs that at the Rejuvenating Fertility Center, which is where I went. And they said don't do it before 30 years old. You don't need to do it before 30, but if it's something that you're thinking about doing and you know that you're not going to have kids for an extended period of time, then you could start thinking about freezing your eggs at around that age.
Good to know. And it's great that you shared your story, especially since you were in the thick of doing things. Typically, people don't like to be as open because it's so personal. So Thank you for being vulnerable and sharing that with everyone so they can understand their journey as well. So I love asking my guests some rapid fire questions. Rate these topics from 1 to 10. The first one is a healthy relationship has sex all the time.
A 5. And the only reason I say 5 is because I would say all the time versus never.
Mm-hmm.
5 is right there in the middle, which is whatever you think is healthy with your partner and whatever you've agreed upon. That's it. If it's once a month because you both agreed on it, that's healthy in a relationship because it's your relationship.
The next one is talking about burnout openly among other physicians.
10,
Mm.
because it's something that we are taught to suck up. Don't
Mm.
complain, suck up. The doctors before you did it, so should you.
Mm.
But I disagree 100%. And I think that we should all be talking about it because it's an issue.
Egg freezing.
Ooh, I would say 7.
Mm.
And I say 7 because not everyone needs to talk about it. You know,
Mm.
you might have or be 28 years old and have 3 kids already.
True.
But if you are in a place where, you know, maybe you're 30, 32, 34, 36, and you're like, I want kids, then I definitely think it's higher up there to have that discussion with yourself, with your physician, with your partner, if you have one.
Getting an O shot for sexual rejuvenation.
Mm, Okay, so I would say 5, and I only say that because it's not fully the standard of care
Mhm.
yet. But just like we said before, there's still so much research that hasn't been done yet on women, and we don't know the long-term effects, whether that be positive or negative,
True.
because it could be wildly positive. And from the small sample sizes that they've done research on, it has been very positive. So the only reason I say 5 is just to honestly to like protect my medical license because it's not that O shots are in, major medical journals at this point. And so it's hard for me at least. Maybe if you're talking to a gynecologist, they would say 10. And if you're speaking to an orthopedic surgeon who's a 35-year-old male, he would say 0,
Mhm.
just because of the information that you have in your specialty.
Good point. So, a question I like to ask all my guests is what does self care mean to you, and what is your vision of well being?
Mm. Self care for me means constantly growing. It
Hmm.
means
Hmm.
questioning yourself, whether it's in a positive way, like questioning, am I happy here? What's my plan next? Whether that comes through journaling or therapy or, talking with friends. That's what self care looks like. And so, just wellness in general. And of course, I have to have a medical plug. So, go see your physician as well, your primary care doctor, of course, and just checking in on all parts of wellness in your body, that is physical wellness, emotional wellness, sexual wellness.
Yes.
And it's just making sure that you are questioning and looking to grow in all of those areas.
Perfect. And I'll leave it at that. Olivia, tell our listeners where they can get in touch with you and your preferred social media contacts.
Absolutely. So on Instagram, you can reach out to me at GlamourPussMD, and that's for some reason British spelling, Glamour. And then DocFluencer MDO on Instagram as well. But you could find me on TikTok at GlamourPussMD as well as on YouTube at GlamourPussMD.
Amazing. We'll be sure to include all of this in the show notes. Love all you do in getting people to speak up about these topics and being so honest and transparent because at the end of the day, that's what it's all about. Thank you for
Absolutely.
joining me today, Olivia.
Thank you so much, Lisa.